You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, big topic. It's a special edition. We're talking about the end of Alzheimer's, how to reverse cognitive decline or stop it, and even how to reverse and stop Alzheimer's. The research is out there, and with us we have an expert on this topic. We're talking about the Bredesen protocol today. With us we have, and we've had him on the program before, Dr. Breen. Dr. Breen, welcome back to the program.
Thanks for having me again, Randy. It's great to be here.
Okay, good. You know, we were talking, because I haven't seen you, I don't know, 6 months. Yeah. You walk in here, you're in a t-shirt, you're walking your talk, you're looking good, and we're in the green room, and you said, I think what separates us is, it's not, go ahead, you could say it, that everybody in your office, you guys kind of walk the talk.
Yeah, one of our core values is results driven. We lead from the front, we do whatever it takes, and I think one of the things, taking care of yourself is a lot of work, and it's hard, and hard work stinks, and not a lot of people want to put in the work. And I think one of the things that makes us so successful is I can look at a patient in the eye and say, you know what, I have 3 little kids, I have a busy practice, I have a busy schedule, I make time to exercise. When I know I'm going to be down here in Carlsbad, I plan my meal. So I bring a Yeti cooler and I have my food. And I think that's one of the things that makes us so successful is that, just like the Marines, we lead from the front and we lead by example. And I think that's missing in the current medical model. If you go to your doctors, just not a lot of them are doing what they're telling you to do. And I think that that's what makes us successful.
Now, for people that don't know your center in Orange County, California, like what are the different, who's a typical patient that sees you?
Right, so right now we focus on men and women who want to optimize their health. So our mission statement is to give you back your health and your life through education, empowerment, lifestyle optimization, and evidence-based protocols. We focus on taking care of men and women who want bioidentical hormone replacement. We treat and prevent cardiovascular disease. We're experts in treating cognitive decline and dementia. We also treat patients with traumatic brain injury. But across the board, there's not a patient in America right now who we can't help because we have put together a comprehensive program that addresses sleep, exercise, water, nutrition, hormone optimization, mindfulness. And it doesn't matter what you title the book, whether it's cardiovascular disease, whether it's dementia prevention care, whether it's gut health, it's all the same. You could just change the chapter. It's take care of your gut, get sleep, exercise. It starts with the fork, and optimize your hormones. So that's what we're doing in our office. We're very passionate about it, and we're getting really incredible results.
Now we should mention, you are one of the most successful, I've been doing my show for 20 years. I know a lot of the so-called pioneers in regenerative integrative medicine. You're one of the most successful guys, if not the most successful guy in the U.S.
And I've surrounded myself with an incredible team.
You say it's not easy.
It's not easy, and it takes a team. So when patients come in to see me, I have a full-time nutritionist that works with them for the entire year on trying to empower them to create healthy food choices. I have an expert who's in my office who does nothing but take care of patients' insulin-resistant cardiovascular health, and I'm focused on their hormone health. But I think that's what makes us successful is we put together an incredible team, and we put together a program that actually works because it is a lot of work and it takes a lot of hand-holding, and we're trying to get patients to create new habits. We're trying to get patients to associate pain with some of the current habits they have and associate pleasure with being healthy, with walking around, feeling vibrant.
Now, Alzheimer's, this book, it's kind of sweeping the country, this Bredesen book. It's titled The End of Alzheimer's. Let's start there. Do you believe that if you catch somebody early enough, you could prevent Alzheimer's?
Yes, and that's what the evidence shows. So it's important we follow what the evidence shows. And I think what Dr. Bredesen doing is tip of the spear. He's a pioneer. I think we're going to look back as this is the birth of now delivering hope to these patients. Because let me tell you what's happening to patients right now.
Okay.
You have a parent or a loved one or a spouse that's having cognitive decline, they're forgetful. You bring them to your doctor, they get diagnosed with early Alzheimer's or dementia. Here's what they're told. There is no cure, there's no way to stop this. It's fatal. So you're gonna live maybe 4 to 8 years. Sometimes you'll live 20 years with this cognitive decline. And by the way, we're gonna take away your driver's license. You're not gonna be able to get long-term disability care. That's a pretty dismal, morbid message that they're getting. And why go to your doctor? Well, what Dr. Bredesen found is that that's not true. We can absolutely reverse cognitive decline and we can prevent it through this lifestyle program, which he has branded as the Recode protocol.
He has more than 1,000 people. I was listening to the podcast this morning. Over 1,000 people that he believed he's reversed or helped reverse their cognitive decline.
Right, and one of the
They're
things I
Alzheimer's.
see in my practice all the time, just optimizing hormone levels and doing hormone replacement, is patients come in with thyroid disease, you give them thyroid, the brain fog goes away. Women in menopause, you're twice as likely, per Dr. Bredesen statistics, to get Alzheimer's and dementia. You give them estradiol, their brain function returns. So when you optimize their hormones, you fix their nutrition, you fix their sleep, and you get them on this Recode protocol, which is very involved, and it's very thorough, and it's very, but you can 100% reverse cognitive decline. I think Dr. Bredesen's showing that. Now, let me back up about the seriousness of why I'm so passionate.
Okay.
Why did I shift to coming down here, wanting to talk about Alzheimer's and cognitive decline? Alzheimer's is the leading cause of death in the UK. It causes more deaths in the United States than breast cancer and prostate cancer combined. Right now, there's 5 million Americans who have Alzheimer's disease diagnosed, and they think over the next 15 to 20 years, it's going to be 15% of the population is going to be diagnosed with Alzheimer's. 45 million Americans with Alzheimer's. This is going to be apocalyptic. So the medical community, starting with guys like Dr. Bredesen, starting with people like me, we need to get serious about this, and we need to get the message out that if you have cognitive decline, or you're genetically susceptible to cognitive decline, which we'll talk about, there's absolutely things you can do. You just need to find a physician like myself.
To slow it or stop it?
To slow it and to reverse it, which is, I think, the important thing, because there hasn't been a successful drug trial for Alzheimer's since 2003. There's been over 100 drugs that have been studied. None of them work because Alzheimer's, it turns out, there's 36 different metabolic pathways that contribute to the pathology of Alzheimer's.
So it's not just one thing.
It's not just one thing.
There's amyloid plaques. I should mention that my mother died of Alzheimer's, complications from that. And it's always about these amyloid plaques. You say it's more than that.
Yeah, it's more than beta amyloid plaque. And Dr. Bredesen's identified really 3 main types of Alzheimer's patients. It's inflammation, so there's inflammatory type. There's what we call a trophic type, which is lack of nutrient and hormonal support. And there's a glycotoxic. So glycotoxins is it's sugar, insulin resistance, right? And I think that's one of the reasons why we're seeing an epidemic of Alzheimer's is because of the obesity epidemic, insulin resistance, which ties into cardiovascular disease. And it's also toxins, environmental toxins, whether it's mold, or believe it or not, if you live within 150 meters of a major freeway, whether it's the 5 or 4 or 5 or wherever you live, your risk for Alzheimer's triple because of the particulate matter that goes right up your nose into your olfactory nerve, into your brain. So it's multifactorial. That's why you can't address it with one drug.
Does your program help detox the body?
Right.
And so here's
how you detox. And it's not easy, right? Because we're constantly being exposed to environmental toxins. But it starts with your fork, right? So obviously don't eat foods that are sprayed with pesticides. It starts with our health and beauty aids, right? So health and beauty aids and foods are the number
like
one.
Topical stuff you're rubbing on yourself.
Makeup, hairspray, shampoo, deodorants. That's a major source of environmental toxins. And so one of the ways we eliminate toxins is we sweat, we poop, we pee, we breathe, right? So that's why drinking water is so important. That's one of the things we stress. You have to drink water. One of the things that we do with our cognitive decline patients is we put them on an exercise program. Now, here's the downside. Sometimes these patients are diagnosed late. They don't have the ability to get in a treadmill, but you have the ability to sit in a sauna. So like infrared sauna is something that I do regularly.
Okay.
It's one of the ways that you can, it's part of the program. Now, the program that we have for patients that come in, because I want to give patients hope, because there's something we can do
to help
you.
If somebody's watching this and Alzheimer's runs in their family, maybe they have even one of the genetic markers, this APO3 or 4 gene.
Right.
You say you can still help those people.
Right, so there are patients who actually have cognitive decline, and there are patients who we know are going to get or very highly susceptible to getting cognitive decline and dementia. There's something called the ApoE gene. Now, Watson and Crick, who invented DNA, Dr. Watson, when asked if he would want to know his ApoE status in 2007, he said no, because why would I want that morbid diagnosis?
To know I'm going to have Alzheimer's.
To know I'm going to get Alzheimer's when there's nothing we can do to treat it. Well, now, every single one of our patients, we do this ApoE genotyping. The general population, the lifetime risk for Alzheimer's is 9%. If you have an ApoE4, there's one allele, your lifetime risk goes to 30%. If you're ApoE4, your lifetime risks approach over 50%, up to 90%, depending on the studies. Now, those are the patients where we can do a blood test at 40 years old and say, hey, you're genetically susceptible, you have it, it runs in your family. Here are the things that you need to start doing now, because here's what we're finding out about Alzheimer's that's so exciting. The pathological changes that start in Alzheimer's start 20 years before you're diagnosed.
Okay.
So 20 years before you're diagnosed, your brain is already undergoing the pathological changes that we see in Alzheimer's. And by the time patients are diagnosed, it's late. And we don't want to get them late. We want to get these patients early. Now, if you are late, we can still absolutely work with you and help you. But there are people right now, for example, who are 45 years old, they're ApoE34 or they're ApoE44, they're forgetting words. They can't find words. They forget the combination to the lock at their gym. They're having a hard time doing math or calculation or numbers. They can't recognize faces. This is subjective cognitive impairment.
And that's been reversed?
That is.
Bredesen says he has seen that reversed.
So Dr. Bredesen has seen not only prevention, but reversal. And again, this is early on. And a lot of the studies that Dr. Bredesen wants to do, they don't want to fund because they want to look at a single variable. They're not going to allow a study that says, well, let me look at when I fix sleep, when I have these patients get them off sugar, we work with their nutrition, right? We optimize their hormones. They just want to see a single variable. And that's why the drug therapy fails. And in medicine, unfortunately, no matter what it is, it starts with your fork. If you want to heal yourself, you fix your nutrition, period, end of story. And I have on my staff, one of my team members, her name is Kathy Edgerton, she goes by Kat. She is the best in the world at what she does. And I don't say that lightly, and I'm not saying that to plug my practice. She is the best in the world at getting patients, empowering them to teach them how to eat clean. Once you do that, patients start feeling better. And then you optimize their hormones, which is part of the Bredesen protocol. When I say hormones, it's thyroid, it's testosterone in men and women, it's estradiol, it's progesterone, and then cortisol.
So you return their hormone levels to where they were more youthful.
The optimal range.
Like you're helping the brain stay young. Is that part of
this? So
it
turns out, in medicine, we know you can build bone and break down bone. Those cells are called osteoblasts and osteoclasts. We've been told in medical school that, hey, once you have your neurons and the neurons die, you can't regenerate new neurons. Well, now we know you can actually regenerate synapses, how neurons communicate. And how do you do that? Well, one of the ways you do that is you exercise, increases something called brain-derived neurotrophic factor. Hormones do that. Estradiol, testosterone, thyroid, they're all what we call synaptoblastic, so they increase synapses. And we remove the dementigen. So dementigen is a word for anything that's going to promote dementia or cognitive decline, and there's a lot of them. And an important one is stress. And stress is part of our life, right? We have these cell phones, we have these gadgets. Yeah. We can't get away from the information.
So you're involved in all this in the practice? It's the only way to do it?
One of the first things I ask my patients is, I say, are you married? And I say, are you happy in your marriage? What do you do for work? Does your work stress you out? Now, before we came in, we were taping here, I was walking around and I was just doing a little mindfulness work. I was just doing what we call box breathing, which we were talking about, which is what the Navy SEALs do as a technique before they go into a firefight to lower their cortisols, to lower the stress levels. This is something we teach all our patients because it turns out that cortisol will actually shrink an area of the brain called the hippocampus, which is involved in memory. And when you shrink the hippocampus, you accelerate cognitive decline. So stress management is a huge part of what we do. And I'll ask patients, well, your marriage is a 5 out of 10. What would it take for it to get to a 9 out of 10? Well, those are the things you need to work. Those are some of the things you need to work on. And that's part of our program. And I'm not saying it's easy. It takes work.
You also give targeted supplements, like supplements that help the brain.
That is true. And
like professional brand supplements.
Right, and you want to use supplements that work. So obviously the supplement industry is huge. You go to Trader Joe's or Costco and there's all sorts of supplements that say this is for the brain and that's for the brain. There are things that we know work really well, and it'll depend. It's not a cookie cutter. It's a very customized approach. If you come in with insulin resistance, I may give you something like zinc or even cinnamon to help lower your insulin resistance. If your problem is inflammation and you're inflamed, we use things like curcumin and fish oils. But again, it starts with food. Okay. Our practice is very food centric. I think it's one of the things that makes us so successful, Randy. And it's one of the things that because we said, let me back up. We were talking before the show. And I said, imagine your doctor said, you have early dementia or Alzheimer's. There's nothing we can do about it. We have these drugs that maybe they'll help with your symptoms. They don't slow it, they don't reverse it. And by the way, the average person lives 4 to 8 years. If you're lucky, you'll live a decade. Okay. What are you inclined to do with that message? You're inclined to go out and live it up. Go out with a bang. Why not eat what you want to eat? Why not have the donut? Okay. Because that's the message you're being told that there's nothing you can do.
Did they do that? So patients will do that?
100%.
Given this death sentence,
why would
now they're saying, why not go to McDonald's?
Why not you? I got 4 years, 6 years left to live. I'm going to go out and I'm going to enjoy cocktails with my husband every night with dinner. I'm going to go out and I'm going to eat whatever I want. That's the exact opposite of what's
That's the
going to
old
help
thinking.
them. That's the
In
old
your
thinking.
book. Okay.
And what Dr. Bredesen's showing is that you could take someone with cognitive decline, reverse that cognitive decline, and improve their activities of daily living. Because the patients that we speak to that take care of Alzheimer's patients, you want to talk to someone that's been traumatized, taking care of a loved one who doesn't know who they are, doesn't know where they are. And as a matter of fact, if you take care of someone with Alzheimer's, your risk for Alzheimer's disease go up twofold. A lot of that is because you're not sleeping. You're constantly crying. You're stressed out. You're being told that there's nothing you can absolutely do. And what I want you to do is go out and get Dr. Bredesen's book.
Read the book.
I have no financial interest in saying this, obviously. Yeah. Go out, educate yourself. Pick up the phone, call my office. I will tell you what it takes to do this. It's not easy, but we will give you a program and it's comprehensive. The average family doctor, the average internist, the average
they just don't have the time.
They don't have the time and they haven't been trained. So we're trained as doctors is you come in with the symptom, I either give you a drug or we do surgery, right? We get no nutritional training, we get no lifestyle optimization. Now, another important factor of what we do in our office is we fix sleep. Now, one of the things that I started doing in my practice, and shame on me for not doing this sooner, is I started screening every single one of our patients for sleep apnea.
Okay.
And the reason why we do that is 65% of patients who are overweight, outside the normal body fat percentage, right? Throw a rock, you'll hit 5 people, have sleep apnea. When you have sleep apnea and you don't sleep, your oxygen levels drop, so you're hypoxic. So it's like holding your breath underwater.
But you're not.
You think you're sleeping and you're not. Your heart rate goes up. You're tired, you have brain fog, you have erectile dysfunction, you're gaining weight, you have hypertension, you have insulin resistance. And what we're finding is when you treat sleep apnea, whether with
hormones and supplements
with
and diet,
weight loss and AutoPAP and CPAP, which is the standard treatment for sleep apnea, these patients get better. What they found, and this is why sleep is so tied into Alzheimer's and cognitive decline. When you sleep, imagine a Zamboni that cleans the ice in between periods at a hockey game. It's like you have a Zamboni that comes and cleans out cellular debris, beta amyloid plaque. It allows your body to go through what's called autophagy, so you get rid of these bad cells and allow new neurons. So sleep is something we absolutely focus on. We've talked about this in the past. You turned me on to the Swanwick sleep glasses, the blue blockers.
Yeah.
Doing some box breathing, limiting the amount of caffeine you drink in the afternoon. Sleep is paramount for patients to get better. Now, if Alzheimer's affects women, right? What's the more so than men? The one thing that we can do for women that we really have a harder time doing for men is we can get them sleeping just using oral progesterone. Oral progesterone in a capsule, 1 to 200 milligrams. It's not FDA approved for sleep, but Dr. Bredesen's seen it. I've seen it in my practice. And women are sleeping like, I don't want to say babies because I've had babies and they don't sleep that well. They sleep like teenagers. They can sleep through the night and they wake up and they feel rested. And that's a huge component to what we're doing, which is not even being talked about. I mean, I started screening for patients for sleep apnea. It's been over 60% of my patients have had sleep apnea. I look back and I look at the
because they're not getting oxygen, right?
They're not getting oxygen. They have hypertension. There are 1 or 2 different medications. And this is a huge part of treating Alzheimer's and cognitive decline. It's something we do. I don't know why we weren't taught, Randy, as a medical student to screen patients for sleep, but that's a huge component to us feeling better.
Now, we were talking in the green room, but it seems like there's like 2 types of people for the sake of this conversation. The people that are going in for prevention, they don't really have cognitive decline yet. I'm on your Recode protocol for that. Then you have the people that maybe they've done the gene testing. Right. They know they're likely. They're starting to lose their keys, can't balance their checkbook, can't drive, get lost, etc. Who do you see more of? I mean, who would you like to see more of?
So
prevention?
Obviously, when you take someone who has Alzheimer's and you give them back any quality of life, that's very rewarding. I'm equally passionate about preventing Alzheimer's dementia because right now, if you don't know if you're genetically susceptible, you got to get your ApoE gene tested, because if you're genetically susceptible, there are things that we need to do right now. Now, obviously in the immediate, you want to see someone come in that doesn't recognize their kids, or they can't get dressed by themselves. You want to see them getting dressed and recognizing their family. There's a tremendous reward in seeing that. But I also have a passion for preventing the tsunami that's going to hit our nation, 45 million Americans. Okay. And by the way, when you look at the numbers, it's going to bankrupt our healthcare system because long-term care is expensive.
In preparing for this interview today, Bredesen said he met this APO, is it APO?
APO4, yep.
4 and 4, both from the mother and the father.
Yep.
And she's 94 years old, on the Recode, feeling great. So it's proved to not be a death sentence to get that
and that's
come up negative or positive.
And that's the shift, right? So the shift is you don't have to lose your driver's license. You don't have to lose long-term disability care. You don't have to forget where you are or your friends. You don't have to forget.
But you got to change the way you eat.
Absolutely.
Is that the toughest part of your job?
And so, you know, again, it goes back to the toughest part of my job is empowering patients to create healthy habits, right? Because we associate so much joy with going out and drinking and eating rich foods. And, you know, that shift, it's like, well, what really makes me the most happy? It's being around for my kids, seeing my kids at their jiu-jitsu or playing with my kids or wanting to see my kids graduate. You know, life is short, right? So patients say, well, life is short, Dr. Breen, so why not live it up? And I say, no, life is short. Why not take care of yourself? That's a reason to take care of yourself. And I think, you know, you asked, is that the hardest thing that we do? In our practice, we're pretty bold. We ask our patients to take all our medical advice for the first 90 days. Hey, you're paying me a good amount of your money. You've worked hard. You're here. You're motivated.
Okay.
Why not take my advice? Because here's what I know, whether it's alcohol or sugar or donuts or you name their vice. When we get them feeling good and they're having better sex with their wife, better sex with their husband, their memories improve, their cognition's back, they look better in their clothes, they're being complimented. Those are the things that honestly bring the most joy in their life. They just don't know it, right? Because they don't experience it. And we've failed them because it's a pill for an ill. Yeah. Medical care is a pill for an ill. And so there's this medical model. There are physicians out there like myself. And I think, listen, I'm not saying this to toot my own horn. There's a lot of great doctors out there. I think we do an incredible job. When I look at what we do, there's not a lot of clinics that are putting the thought, the time, and really the demands on our patient to actually get them to take change. And when our patients take change after 90 days, whatever it is, normally what they say is, you know what, I don't miss it. I feel better. I look better. I've spent less money. My quality of life didn't go down. I still could go out and socialize with my friends.
Look, I'm on your prevention protocol. One of the side effects that I lost weight. My cravings have gone away. I sleep better.
Yeah.
I feel better.
Right.
I told you, this is the lightest I've been almost in my life.
Right. And in the nutrition,
following this protocol.
Right. In the nutrition protocol, the protocol, listen, the number one thing you need to do is stop eating sugar, period, end of story, right? That's it. You have to stop eating sugar because sugar's it's a neurotoxin, it's glycotoxic, right? So it's toxic to the brain, and we have to take sugar out of your diet. That's the most important thing.
And this is kind of like a smart keto diet in a way. I mean,
right, so it's plant-based, it's ketotarian, so it's plant-based keto, okay. So mild ketosis tends to be what works best. Now, that's not easy to do. You need someone to hold your hand and walk you through that. You need someone to teach you how to shop. You need someone to teach you how to read food labels. It's not just a 1-hour visit at my office and I say, go do keto. We have a program where you sit down with my nutritionist for the entire year and we support you for that entire year. We answer your questions, we allow you to come back. That's what it's gonna take to create change in education.
You say eating carbs or high levels of insulin or insulin resistance, you say can give you Alzheimer's.
Right, because it has to do with how sugar and insulin drives inflammation in the body.
Okay.
Inflammation is how our immune system talks to itself, just to kind of, it's very complicated. I don't know a way to dumb it down other than saying that's how the body communicates with itself. What they're finding is when they dissect and they do post-mortem autopsies, they'll have brains that have all the hallmarks of Alzheimer's, the neurofibrillary tangles, they'll have the beta amyloid plaque, and they'll go back and they'll say, well, this patient had 0 symptoms, 0 cognitive decline. What they're finding is here's the difference. It's whether or not there's inflammation in the body, inflammation in the brain. So when you're eating a lot of sugar or processed foods, you're driving insulin up and you're driving inflammation. And that's what we're trying to get down. It's the hallmark of type 1 Alzheimer's. Inflammation, it's hot.
But the only argument I could say is everybody knows you shouldn't eat sugar these days, but good luck trying not to.
Right.
But the diet you have, this Recode,
right.
It's like the cravings for sugar go away.
Right. Your cravings for sugar go away
right?
when you sleep and you reduce your stress, you optimize your hormones and you're exercising. And then, part of it is too, right? You're eating a ton of sugar, you get a lot of candida in your body. There's a yeast die-off, so that candida craves sugar. And if you cut out sugar for a week or 2 weeks or 30 days, your sugar cravings go away. Your taste buds change. So things that used to be not sweet become sweet again. And so is giving up sugar a challenge? Do you have to work at it? Absolutely.
So you give them techniques or strategies to kind of bridge over. It's not a cold turkey situation?
No, and again, we focus, it's baby steps, right? And so sometimes patients will come in and say, hey, Dr. Breen, Kat, give me the program. I will follow and do whatever you tell me to do. Other patients,
I did that, by the way, for you.
And other patients, you have to slowly wean them off because, right, we have patients who grow up in the Midwest, they just drink milk all day, right? It's dairy, which is pro-inflammatory, it's mucus producing, and they're not gonna just give up milk. Or you get patients that fly in from the South and they're drinking sweet tea all day, right? So if I'm practicing in the South, I'm practicing in Orange County, if I'm practicing in the South, drinking sweet tea is a major problem. These people are drinking tea loaded with sugar throughout the day. That's how they grew up. They created their relationships. They sat around the kitchen table. So it's more than just sugar. It's a memory of their youth, right? So we have to do a lot of work on their mindset and their psyche. And again, I'll tell patients this all the time. I'm just as much Tony Robbins as I am Dr. Breen.
Okay,
because a lot of what we're trying to do is associate pain with sugar, right? So when someone says to me, well, I love sweet tea, and I'll say, well, do you love your daughter? Do you want to see your daughter graduate high school? Do you want to see your daughter walk down the aisle? Drinking this sweet tea, even though it reminds you of your youth and it's what you've done your whole life, it's going to rob you of your ability to do that. And I think once you start talking in those contexts, it starts to click. Not with everyone. Not everyone wants to get better, Randy. I found that out in my practice. Some people are okay with dying.
I hate to cut you off, but we literally are out of time. Probably a minute left. Final message. Somebody watching this, Alzheimer's maybe runs in their family.
Right.
Or they were tested, have one of the genetic markers.
Right.
Or maybe they have no symptoms, but they just want prevention. But they're skeptical. They're going, I don't know. Sounds too good to be true. I don't know if there's any data on this or any research, published articles.
Right.
What do you say to them as your final message?
First thing I want you to do is read Dr. Bredesen's book, The End of Alzheimer's. It's fantastic. There's tons of references, there's tons of citations. And then pick up the phone and call us. And I'll talk to you. I'll get on the phone and I'll talk to patients.
You will?
Of course.
Okay.
And that's something that we do. That's something that we do because we want patients who want to help themselves, and we want patients who are motivated. And I can tell you, if you come to my office and you want to get better, we will give you the program to get better. Now, part of it is they have to get up off their butts and move, and we can't do it for them. But we have put together, I think, the most comprehensive program for reversing cognitive decline, preventing cognitive decline, and optimizing patients' wellness, period.
Okay, good. I want to thank you for coming on the show. So if somebody wants to learn more, they go to your website.
Go to our website, which is right now drbreen.com.
They can make an appointment on your website as well.
They can contact us. One of our team will contact them back. We'll get the set of labs, which Dr. Bredesen talks about in his book of biomarkers that we need to in order to effectively treat you. We'll get you in our office. We'll do a whole diagnostic workup, and you'll be on your way.
Okay, good. Final question. Why is it called Recode, this eating? Recode.
Right. So Recode is reversing cognitive decline. That was his that was his whole message, and I love it because it's catchy, it's easy, it's the Recode protocol, and again, I think our office and our practice, we do it extremely, extremely well, and we're excited about it.
Okay, good. Thanks again for coming on the program.
Randy,
good stuff.
Great seeing you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.